How South Korea flattened the curve. No matter how you look at the numbers, one country stands out from the rest: South Korea. The country showed that it is possible to contain the coronavirus without shutting down the economy, but experts are unsure whether its lessons can work abroad. At the peak, medical workers identified 909 new cases in a single day, February 29. But less than a week later, the number of new cases halved. Within 4 days, it halved again, and again the next day. Italy records several hundred deaths daily. South Korea has not had more than 8 in a day. South Korea is one of only 2 countries with large outbreaks, alongside China, to flatten the curve of new infections. And it has done so without China's draconian restrictions on speech and movement, or economically damaging lockdowns like those in Europe and the United States. And those lessons are: swift action, widespread testing and contact tracing, and critical support from citizens. Yet other hard-hit nations did not follow South Korea's lead. Some have begun to show interest in emulating its methods, but only after the epidemic had accelerated to the point that they may not be able to control it anytime soon. South Korean officials caution that their successes are tentative. A risk of resurgence remains, particularly as epidemics continue raging beyond the country's borders. The country now produces 100,000 kits per day, and officials say they are in talks with 17 foreign governments about exporting them. South Korea could deal with this without limiting the movement of people because we knew the main source of infection, the church congregation, pretty early on. If we learned about it later than we did, things could have been far worse," said Kim Ran, an epidemiologist. South Koreans, unlike Europeans and Americans, were also primed to treat the coronavirus as a national emergency, after a 2015 outbreak of Middle East respiratory syndrome in the country killed 38. The coronavirus is thought to have a 5-day incubation period, often followed by a period of mild symptoms that could be mistaken for a cold, when the virus is highly communicable. This pattern creates a lag of a week or 2 before an outbreak becomes apparent. What looks like a handful of cases can be hundreds, what looks like hundreds can be thousands. South Korea has tested far more people for the coronavirus than any other country, enabling it to isolate and treat many people soon after they are infected. The country has conducted over 300,000 tests, for a per capita rate more than 40 times that of the United States. Testing is central because that leads to early detection, it minimizes further spread, and it quickly treats those found with the virus, the key behind our very low fatality rate as well. Kang Kyung-wha Opened 600 testing centers designed to screen as many people as possible, as quickly as possible, and keep health workers safe by minimizing contact. At 50 drive-through stations, patients are tested without leaving their cars. They are given a questionnaire, a remote temperature scan and a throat swab. The process takes about 10 minutes. Test results are usually back within hours. When someone tests positive, health workers retrace the patient's recent movements to find, test, and, if necessary, isolate anyone the person may have had contact with, a process known as contact tracing. This allows health workers to identify networks of possible transmission early, carving the virus out of society like a surgeon removing a cancer. South Korea developed tools and practices for aggressive contact tracing during the MERS outbreak. Health officials would retrace patients' movements using security camera footage, credit card records, even GPS data from their cars and cell phones. As the coronavirus outbreak grew too big to track patients so intensively, officials relied more on mass messaging. People who believe they may have crossed paths with a patient are urged to report to testing centers. South Koreans have broadly accepted the loss of privacy as a necessary trade-off. For all the attention to South Korea's successes, its methods and containment tools are not prohibitively complex or expensive. Of the 7 countries with worse outbreaks than South Korea's, 5 are richer. Experts cite 3 major hurdles to following South Korea's lead, none related to cost or technology. 1 is political will. Many governments have hesitated to impose onerous measures in the absence of a crisis-level outbreak. Another is public will. Social trust is higher in South Korea than in many other countries, particularly Western democracies beset by polarization and populist backlash. We probably lost the chance to have an outcome like South Korea. We must do everything to avert the tragic suffering being borne by Italy.